Good evening and greetings. I am Dr. Nath Ghosh. I am a senior cardiac surgeon at Apollo Hospital, Kolkata. My clinical practice in cardiac surgery has got a background of almost 20 years. And one medicine which we have been using regularly over the years has been the use of this anticoagulants. Anticoagulation, by this time, most of you are aware that it is a blood thinning drug, and one of the leading medicine in this group is warfarin. So I'm going to discuss today that what is the role of anticoagulation in cardiac surgery, and if we are talking about that, then I can broadly mention there are mainly two categories where we are using anticoagulations. First and foremost is the valve surgery. Valve surgeries are a group of surgery which we very frequently perform. Other than valve surgeries, where it can be used are in a complex cardiac surgical procedures where some prosthetic materials are being used, and in complex CABGs, which I am going to discuss later. As far as the valve surgeries are concerned, we have to realize that when we replace the valve, there are two types of valves which we use. One is called mechanical valve, another is called bioprosthetic valve. The mechanical valve has basically it is made of certain substances like titaniums, nylon, part of some other materials where there is a chances of coagulation or clotting of blood when the blood passes through it. So it's basically purely a very artificial material which when comes with the blood interface or in touch with it, there is a chance to trigger the mechanism of clotting. But bioprosthetic valve is on the other way, is a type of valve where we are using animal tissues. So the chances of blood clotting in these valves are less. So it's a common sense that when we are using anticoagulation, then obviously the mechanical valve recipients will have to receive this anticoagulation for whole life and regularly. Whereas in cases of bioprosthetic valve, it has to be obviously for a smaller interval, which has been more or less decided that we carry on this anticoagulation in cases of bioprosthetic valve for a period of 3 months. Now, there may be a question that how we come to know or monitor that what is the requirement of this anticoagulation. So there is a test which is very routinely done. It's called INR, International Normalized Ratio. With the help of that, we can actually figure out what should be the amount of the blood thinning which is required for the patient. And the next question also comes in the mind that as we know, the valves are put in the heart at least in 2 to 3 different positions. One position is called mitral valve, another is the aortic valve. Sometimes we do double valve replacement, and sometimes we even replace the third valve called tricuspid valve. Now the question is there a different requirement of anticoagulation for these different valves in the different settings? So the answer is yes. There is a difference. If we are using a prosthetic mechanical valve in a tricuspid valve position, which we rarely do that type of surgery, but I must tell you this is the position where there is a highest chances of blood coagulation and the chances of valve thrombosis. The next position is of mitral valve, where the chances of thrombosis is lesser than the tricuspid but more than the aortic. And then there is a third position called aortic valve, where the chances of valve thrombosis is lesser compared to the other valve positions. In a DVR, we are of course using two valves in a patient. So all for these different settings, we have selected a different INR desired level. Say for mitral valve, we have kept it between around say 3 to 3.5 maximum. For aortic valve, it is less, 2.5 to 3. For double valve, it is again 3.5. For a tricuspid valve, again it is a 3.5. So these are the INR levels which we are looking for when we are optimally going to anticoagulate the patients. Now the most important question for the message for all the patients who are going to use this medicine is that given a choice, that if you take this medicine and your INR level is not high, that means your blood is not thin. And then the other choice is that you have taken this medicine too much, leading to the blood has become too thin. Which condition is going to be more dangerous? You know, the interesting part is when you have consumed more anticoagulation and your blood has become thin, that there are a lot of signs and symptoms which is very easy to foresee, and you can as a patient can pick up yourself. Like if you consume more amount of this drug, the chances are there will be bleeding, and this bleeding will be very obvious. You use your toothpaste, you can have a gum bleeding. You cut one of your skin surface, you'll have a profuse bleeding which is not easily being stopped. So there are so many ways you can pick up that there's something wrong. But when we are talking about a blood which is thicker, unfortunately, we don't have much of clinical symptoms and signs to help you out. Only when you are in serious trouble. What is that trouble? That valve has become clotted, what we call a thrombus valve, and in that circumstances, your valve is not opening nicely. Now there is a huge obstruction or what we call gradient developing. Now you are in a serious trouble. Slowly you develop breathlessness. This may be markedly increased over the period of say next 7 days. Then the features of low cardiac output, different multi-organ dysfunctions, and by the time you land in a hospital, you are in a very, very serious condition. And I tell you, these are one of the most serious emergency, cardiac emergency we deal in our emergency room. Now the question is, what is the treatment? There are only two treatments. One is trying to dissolve the clot by giving some injections, that called thrombolytic therapy. But unfortunately, thrombolytic therapy many times doesn't work, number one, and it also carries a serious complications of CNS hemorrhages, means brain hemorrhages, etc., etc. So the next treatment is more difficult, that is that we have to take the patient again for surgery, take out that thrombus valve and re-replace the valve. But when we are doing this particular procedure, by the time the patient is very sick, even a surgeons perform an outstanding surgery, many times the patient, due to this multi-organ dysfunctions and involvement, finally succumbs after this surgery. So the carry home message is that whosoever is having this mechanical valve, they should be very worried. They should be always bothered about whether they are consuming the medicine regular intervals, they are getting their INR checked from the regular interval from a good qualified laboratories, and they are also consulting their doctors. They should be also aware that they are introducing any new drugs, or introducing any new diet in their system, because this can also change the level of INR, or what you can say the level of anticoagulations. So these are the things which they have to understand. Other than that, there are other issues like use of anticoagulation in pregnancy is not a correct approach, because these anticoagulants can have some teratogenic problems, means the problems which can sort of produce birth defects in your child. So it's a serious complication. So you cannot have the pregnancy on its own, it has to be planned. This warfarin has to be adequately stocked, and it has to be replaced by some injectable anticoagulation. So there are certain issues. So that means in that circumstances, you again should be in touch with your doctors. Similarly, if you are a mother who is breastfeeding your child, then this particular medicine can be passing through the milk into the child, leading to the bleeding complications. So there are many issues which I think is very important to appreciate and know. So important thing is that when we are talking about this particular medications, then we should be also very responsible about it. We should be aware everywhere. When you visit a doctor, you should carry with yourself previous prescriptions, and you should tell the doctors, because nobody knows what sort of surgery you have undergone in your life. You have gone for a say dental procedure and you don't reveal that you had this valve operations, you are on anticoagulation, that can lead you to serious problem. Similarly, you are undergoing a major surgery, you have to tell the doctors that you have been taking these anticoagulations. So these are the very important issues which I think all the patients should be aware of who are on anticoagulant therapy. But important thing is, thanks to this anticoagulant therapy, this is a very, very important medications which keeps your valve safe, and definitely it increases the longevity in a patients of all these valve replacement patients who have received mechanical valves. So this is most important indications as we have been talking. Other areas where I have been using this is, say, I perform a very complex cardiac operations in which, say, a coronary artery bypass, where we have to remove lot of plaques, which we call endarterectomy. So that means a lot of clots or substances from inside the coronary arteries. Then these are the arteries, they are very much exposed to further fresh formation of thrombus. To prevent that, we also use warfarin. So warfarin is used in a coronary endarterectomy patients who have undergone a CABG recently, and this is how there are fair amount of indications that this helps the patients. So what I'm trying to say once again, that this is a very important drug. The message, carry home message is that everybody who has received a mechanical valve in a valve surgery group or has undergone a bypass operation, when the medication has been prescribed by the doctors, they should be in touch with the doctors and they should never stop the medications on its own. And I think this is a very important thing which all the patients should realize. That's all. Thank you.